So 120,000 birds have reportedly been culled due to the detection of an unknown strain of avian flu at 2 commercial farms in the Western Cape. Now, we're hearing that there are fears the outbreak could be exacerbate, I should say, already soaring food prices. For more on this, we can speak to Dr. Mpho Maja, Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development. A very good evening to you, Dr. Maja. Thank you for your time. So, does South Africa have a crisis on its hands here with avian flu?
Good evening to the viewers, and let me start by wishing everybody a happy Freedom Day. No, I would not say we have a crisis. So far, we've only had 2 cases reported in the Western Cape, both of them being commercial layer farms, table egg layers. It's not a crisis, and I do not anticipate that it will affect food prices, especially if we, an industry, do what we know needs to be done to reduce the risk of introduction of infection onto properties.
And what do you need to do to reduce that risk?
We need to intensify and be vigilant on our biosecurity measures. So avian influenza is transmitted either by direct contact with wild birds, or when your workers or yourself, you don't clean, disinfect properly, or use equipment that may have been used somewhere else, and it brings infection. So that is what we mean by improving biosecurity and being very vigilant.
And what is this heat treatment protocol for mechanically deboned chicken that some in the industry have suggested that it may need to be implemented, but I know not everyone thinks it's necessary at this point?
That would be for product that would have been slaughtered, so that would be meat, and to inactivate the virus that is possibly in the meat. The World Organization for Animal Health has protocols that are developed and scientifically proven to be able to inactivate the virus. So that's what it basically means. It's short treatment, heat, and over a very short period of time, and the virus gets inactivated. Is
it absolutely necessary at this point?
Not for our production systems, no. What industry is actually suggesting and proposing is that we do that for meat that is imported from other countries. We do that as a basis anyway. If a country reports highly pathogenic avian influenza, we normally suspend trade with that country for raw meat and live birds. But anything else that has been heat treated, as the World Organization for Animal Health recommends, is permitted from day one.
The poultry sector is not a small one. How then do you as officials make sure that there is adherence to the safety protocols that you are now encouraging in order for you to be able to monitor the spread in order to avoid a crisis?
Remember, the losses are actually felt more by the producers. So what we do as government and as regulators, we advise them to improve biosecurity. And that's why in my first statement I said, provided us as government and veterinary services and the producers do what needs to be done. We can only encourage, we can only guide and advise what needs to be done.
What about informal trade? I mean, for many of us who grew up either in a township setting or rural setting, you know someone or have seen someone selling live chickens, for instance, on the side of the road. How easy is it to monitor an avian flu outbreak in that sort of setting?
Fortunately, avian influenza does affect all poultry. I need to make that very clear. But with smaller populations, it doesn't establish itself, or it doesn't establish itself that well. So for the small producers and roadside markets, you hardly ever find avian influenza outbreaks in those communities. We mainly see it in big commercial farms purely because of the numbers. Once one bird gets infected, it infects others, and you end up with what we call viral cloud, and more birds being affected and therefore spreading like wildfire. So small populations are really not that much at risk.
And for consumers of poultry then, if you do eat a chicken that had avian influenza, does that have any consequence for you?
The avian influenzas that we have dealt with so far do not affect people. There are reports, however, in Asia of avian influenzas that have mutated significantly to affect people. So far, we are fortunate we don't have those avian influenzas. But secondly, influenza is a very what we call heat labile virus. It gets easily inactivated by cooking. So most of us do eat chicken after thorough cooking, so the consumers are very safe. And all the poultry meat that you find on the shelf that would have gone through the formal abattoir slaughter process with meat inspection, that's perfectly safe for the consumer.
And I know you said earlier that we're not staring down the possibility of an increase in poultry prices. Is that to do with some of the reporting that we're in fact overproducing poultry at the moment? Is that true?
I don't have the production figures at my fingertips, but I wouldn't think that we are overproducing poultry. Otherwise, we would see a decline in imports of poultry meat from other countries.
All right, Dr. Mpho Maja, Director of Animal Health at the Department of Agriculture, Land Reform and Rural Development. Thank you so much for your time as always.